Hello, my name is Dr. Leila Turner. We have the doctors here from Living Wellness Medical Center, and we have some questions about hormone therapies. So we're going to start out with a question for Dr. Khalsa. What is the difference between non-bioidentical and bioidentical hormones?
All right. So basically, it's kind of how the name implies, how it sounds. Non-bioidentical hormones are not identical to what our bodies naturally produce, and bioidentical hormones are. And so our bodies have kind of seen them before and know how to metabolize them in a healthy way. And so people tend to do better with the bioidentical hormones. They feel better.
Great. Dr. Brower, can you give us kind of an overview of what are all of the hormones when we're talking about hormone replacement therapy?
Sure. I mean, there are a lot of hormones in the body that control different body systems, but the ones we mostly think about are our reproductive hormones, our thyroid hormones, and our adrenal hormones. So adrenal hormones are DHEA and cortisol. Thyroid hormones are T3 and T4 thyroid. And the reproductive hormones for females are estrogen, progesterone, and testosterone. And for men, we mainly focus on just testosterone.
Dr. Khalsa, what are some of the symptoms of low estrogen?
All right. So low estrogen, essentially, one element of it is heat. So women tend to have a lot of hot flashes and night sweats, and all that heat tends to dry everything up. So women, once again, tend to have vaginal dryness, really dry skin. They start to notice those changes. But then you can also start to notice weight gain. Maybe that, an extra 10 pounds with no change in diet and exercise. Sometimes sleep issues, mood issues start to come up. So those are the main symptoms of lack of estrogen.
Dr. Brower, can you tell us what would you say some of the symptoms are of low progesterone?
Well, progesterone is really important in a female body. It's our most important calming hormone. So agitation, anxiety, poor sleep, those are the main things that we see. It can be also involved in vaginal dryness and sexual functioning and response, but the main ones that I see predominantly are right around menopause. Women have a really hard time sleeping, and that's generally a lack of progesterone.
Dr. Khalsa, what are some of the symptoms that you see related to low testosterone?
So it's a little bit different for men and women, but similar too. There's some crossover there. For women, typically low libido. That's the main symptom. But also weight gain, and not able to sort of build muscle the same way that they used to be able to with the same level of exercise. Fatigue, that's a big one for men and women. And so similarly for men, low libido, kind of lack of zest for life, so to speak, and just a big shift there that they might notice. And so those are the main things. Libido and energy tends to change.
Dr. Brower, can you tell us what are all the different types or ways of taking hormones?
Sure. Yeah, there are a lot of delivery methods, so we can make sure that we get the mix just right for our patients. It can be anything from hormone creams to pellets, which are implanted under the skin. There are patches. There's oral forms like triturates or lozenges that dissolve in the mouth, or capsules that you can swallow, and injectables, maybe one of the lesser popular ones, but work really well too. So lots and lots of ways that we can get them in, so we can make sure that the ones that we choose are just right for the unique needs of our patients.
Dr. Brower, can you tell us what are some of the theoretical or hypothetical risks associated with hormone replacement therapy, and maybe what's your opinion on those hypothetical risks?
Yeah, that's a great question, because there's so much misinformation out there, not only that's just spread out on the internet and through the media, news sources, but even other doctors that don't really study bioidentical hormone replacement can spread myths around things like estrogen itself is going to increase your risk of breast cancer. Not true. There are very safe ways to give estrogen to women that do not increase the risk and actually can reduce the risk. Also, a big, really poorly done study was put out several years ago that said that there was an increase in heart disease in men when they did testosterone therapy, and actually The study showed the opposite of that, but the way it was reported was really false. So there are a lot of myths about it. There are no health risks with the hormones, but there can be side effects that we can mitigate. Things like, maybe you could get acne or increased facial hair or things like that, but things that we can work around. So not really risks, but maybe some little side effects.
And here's a question for all of us. At what age should someone stop taking bioidentical hormone replacement therapy? Well, I think that the question is, how long would somebody like to continue to enjoy the benefits of those hormones? Maybe never. I'd like to always have the benefits of those hormones. So I think that it really depends on what the patient is most comfortable with.
Yeah, and definitely, because again, there aren't risks. There's not a need to get off it at some time because it's going to cause you harm. It's actually helping to prevent certain diseases and declines of aging. So the longer you use them, the less of those declines like muscle atrophy and poor libido and quality of life issues. So I personally, when I'm old, I'm not going to stop.
Cheers to hormones. All of us at Living Wellness Medical Center offer a free 10-minute phone consult. So if any of you are interested in chatting with one of us, we can talk with you about maybe what some of your symptoms are and what our approach might be. You can find us online at livingwellnessmedicalcenter.com, or our office phone number is 480-588-6856. There will also be a hormone quiz available with this video. We hope you enjoy it. Take care.